This is how far we are allowed to follow doctors and nurses to one of 2 intensive care units at Howard University Hospital. This medical center in Washington, D.C. has been serving the African American community in the city for over 150 years.
Most of our patients are poor. Most of our patients live in health deserts. Most are uninsured or underinsured. Most are unemployed and have other disproportionate impact, what we call social determinants of health.
Here in Washington and elsewhere across the country, high-quality primary and preemptive care can often be absent and unaffordable in poorer neighborhoods and communities. The lack of access to healthy food sources is another factor that accounts for the stark difference in numbers of COVID-19 related deaths in predominantly African American and white communities. This is Dr. Wendy Ellis. She spent years researching the root causes and impact of what she says are systemic inequities on predominantly African American and other minority communities. She's not surprised that Black Americans are impacted by COVID-19 at a disproportionately higher rate.
Pre-COVID, you had a higher proportion of individuals with hypertension, with diabetes, with obesity. These things that are the leading causes of death in the country and the leading chronic diseases in this country. It's not surprising that individuals that already had that higher proportion of those immunocompromised diseases would then be at the higher end of the toll.
Anacostia, one of the most economically and socially deprived areas in the District of Columbia. Martha's Table, a non-profit organization that serves underprivileged communities, is based here, providing healthy food and offers education on healthy food choices, among other things. For many residents of Anacostia hit disparately hard by the coronavirus, the work carried out day in, day out by volunteers is critical.
This is a food desert. There's only 2 grocery stores in this neighborhood, and there's a lot of people that don't have the resources to either get there or shop there. So we came here because we knew that this is where the food resources were needed, as well as the education.
Giving families healthy food choices they normally can't afford is perhaps just a band-aid right now. But many hope that America's coronavirus crisis could finally trigger real policy change that aims at making underprivileged communities healthier, more affluent, and with that more resilient to a public health crisis in the future.
And I am joined now by Kalipso Chalkidou, Director of the Global Health Policy think tank, the Center for Global Development in London. Thank you so much for joining us this afternoon. And I'd like to begin by asking you, because some have called the coronavirus a great leveler, impacting poor and rich alike. What is your response to that sort of language?
I'm not so sure. You've just demonstrated, using the United States as an example, how the most vulnerable and poorest amongst the US citizens are the worst hit. And when you look at countries, unfortunately, African nations, South Asian nations are much more likely to be hit the hardest. Perhaps not just the direct effects of the virus, but the effects of the global economic shutdown that the global north is imposing to manage the outbreak.
So with that in mind, what would you recommend? I mean, what coronavirus measures do you think should be implemented in less affluent countries and in less affluent areas within countries themselves?
So I think, first of all, one size does not fit all. I do not think that we can take the measures imposed in the United Kingdom or in the US or France, Italy, and try and implement them directly in sub-Saharan African nations for all sorts of reasons. The African CDC has issued guidance on more staged rollout of measures for suppression. But I think if we were to pick the top 3 or 4 things African governments could do, first of all, water and sanitation, low-tech water supply. We know wash interventions are very effective and will do good after the virus is gone in terms of saving lives. Secondly, when you look at social distancing, it must be done in a way which takes account of the realities of poor nations. People live in crowded spaces. 90% of the people work in the informal sector. So these people must go to work or they will starve to death, they and their families. So we must consider this as the starting point. And whilst we're talking about scaling up hospital capacity, let's concentrate again on simple things that we know save the most lives. Oxygen, physiotherapy, chest physiotherapy, suction, that will save lives in normal hospital settings as opposed to high-tech ICU ventilators, which may well not be feasible in countries without electricity, for instance.
Simple things that are in dire need. Just briefly before we go, I'd like to ask you, because we hear a lot about, the global economic impact of the coronavirus. And I'd like to ask you briefly about how you see the impact on global poverty in particular going forward.
I think it's likely to be a tragic impact. We're already looking at forecasts of millions of people falling into poverty. And this reduction in GDP in sub-Saharan Africa, which could be up to 6 percentage points, will directly result in hundreds of thousands of deaths. For instance, we estimate about 300,000 children will not live to see their first birthday solely as a result of the projected economic contraction. So this is a direct health toll of the economic downturn.
Kalipso Chalkidou of the Global Health Policy, Director of Global Health Policy, at the Center for Global Development in London. Thank you.
Thank you.